1 second. All right, we will now begin with Acting Chief Health Officer, Dr. Fermin Leguen.
All right, thank you, Corey. Thank you for being here with us today. We understand that there are a lot of important issues going on right now in the country, so we really appreciate your presence here with us. I want to say that here with me is Joanne Rupiper, who is our Chief Administrative Nurse and Director of Clinical Services, and also Jeff Quinn, who is our Manager for Public Health Preparedness. We wanted to share with you some information about the COVID vaccination campaign, and also take the opportunity to answer some of the questions that you might have. Until today, we have administered a total of 21,000 COVID vaccines here in Clark County, both from Pfizer and Moderna. The vaccines that we administer, and when I say we, it doesn't mean the health district alone. It's also our partners, UNLV, Rosemont University, Touro University, also EMS and firefighters who have been partnering with us, and also other groups in the communities. So all those doses are received through the state of Nevada immunization program. Some facilities outside the health district receive the vaccines directly, and others receive vaccines through the health district. Right now, we are providing vaccines to individuals who are identified as members of the Tier 1, which basically comprise healthcare workers, and also the residents of nursing homes of advanced care facilities. Right now we open a point of vaccination at our main facility in Decatur for the health district. We started that yesterday, and also we are offering vaccines at Western High School that we also started yesterday by the health district. I have to mention that locally in Clark County, the vaccination campaign started December 14. That's when our hospitals received the first shipment of vaccine and started administering to their staff. But now we are moving beyond the hospital base and offering the vaccines to healthcare providers from in the small primary care practices or behavioral health centers and other non-hospital affiliated personnel. I also want to tell you that there is updated information about immunization campaign posted in our website. We started posting that information yesterday, and today there was an update to that information. And we will provide weekly summaries of our immunization campaign that will be posted in our website, in addition to other information that we might be sharing with you in daily basis as those events occur. I will ask Joanne Rupiper, who is our Chief Administrative Nurse, if there's something else that we want to share.
Sure. So we're going along according to plan for our vaccination campaign. And the hospitals have received their first and second doses of vaccine for their employees. And we've been concentrating mostly on that for the last 2 to 3 weeks. This week, we are continuing with the other groups in the tier 1. And we are simultaneously getting vaccine to partners, starting pods, and then planning for future groups. So we're right on target, and we have the vaccine available. So we're working really hard with a lot of partners who are really excited about the ability for us to give vaccine to our residents.
Okay. Thank you. Jeff, you want to share what we're going with the county, the MAC?
Yeah, so the health district in working closely with our community partners, as Joanne and Dr. Ligon have referred to, we don't wait to plan for, while we're providing vaccinations for tier 1 right now, we're planning for tiers 3, 2, and the general public down the road. So pretty much we're asking for people's patience. The positive and the good news about the vaccine is that it's here, that we're administering vaccine, and we're closer to the end of the tunnel of everybody that wants vaccine to get it, in converse to where we were 10 months ago. So it's a very positive, optimistic time, but we're just going to have to remain vigilant to ensure that we have enough vaccine available weekly, and that we're providing it to everybody that is in the assigned tiers right now.
Thank you. Cody, you want to open it for questions?
All right, everyone, please use the raise hand feature if you wish to ask any questions at this point. So if you're joining us on the, well, there we go. There we go. We've got some questions. Okay. Let's see. Our first one just came in the chat box. It says, for those of us companies in tier 2, how do we sign up to partner to get employees vaccinated? Is there a waiting list or application?
Okay.
Pretty much, there's multiple ways. I'll let Joanne speak to it, but one way is for the health district to be aware of individuals. We want people to query and survey their own employees to see how many employees actually want to get the vaccine. That's a number that we need to know. If we can get a point of contact with each facility, we run a database where we keep track of the individuals that reach out to us to contact us to say, hey, when we get to tier 2, we're ready and waiting for instruction on where to go. Now, as Dr. Ligon alluded to, it won't necessarily be just the Southern Nevada Health District that's providing those vaccinations. It could be one of our university partners. It could be county fire, the private ambulance companies, could be the hospitals themselves that are actually the people that will administer the vaccine. But for folks, we just ask for people to contact us so we know generally how many employees that they have that meet the tier 2 criteria, and we'll keep track of that. So when vaccination sites are identified and set up, we will send invitation to groups of people to have them come to the venue and be vaccinated. Now, when we do that, we are checking IDs. So, a work badge, some form of documentation that actually, even besides a regular ID that demonstrates that they are in the sub-tier population that we're targeting at the time, we'll be checking for those. So that's all very much helpful for us.
So for companies and employers, one of the things to find out is it really helps if you already have a medical facility or a provider, okay? For example, Southwest Medical Associates is a medical facility. They have the capability to give the vaccine, and so they signed up with the state and they're able to receive the vaccine and give to their employees. And then in the future, they'll be able to give it to their patients. And that's kind of the model that we're using. For employers that have employees in those tier groups, think about how did you get vaccine for flu, and how would you how would we go about doing getting vaccine distributed to your employees? So the larger organizations, it may be good to reach out to us to kind of problem solve on how to get that done. For example, we have a couple of groups like our EMTs and our paramedics are ready to give vaccines. Right now, they're doing their own groups, and then they'll work within their organizations to provide vaccines to other groups as well, partnering with vaccinators. Another example is UNLV will be starting out vaccine clinics. They're going to work on their tier 1 in their Nevada system of higher education. They'll work within that group, and then they'll be able to help us out with the community. So that's kind of the model that we're using, and people really should be checking back with the webpage frequently, because these plans can change from week to week, sometimes day to day, and we will have new partners and new opportunities for vaccinations.
And the Joanne mentioned our webpage, just so everyone knows, we do have our special COVID site set up at snhd.info/COVID. It's full of information on, there's a whole vaccine section in there. There's a section also for healthcare providers specifically, with information on how to get shots for their facilities or get their staff vaccinated. There is a tier 1, 2, 3, 4 explanatory page that has a lot of great info. So everyone remember, that's snhd.info/COVID. We did have a follow-up on this question before we move on. They said, can you provide info to submit, like an email or a phone? That was from the same person who asked this question.
Right. So Corey, I believe we have a vaccine request form.
There's on our website, we've got the facility request form for the folks who are in tier 1 or at least
interested in getting vaccine, right? And if individuals are looking for vaccines, like, well, they realize they're in tier 1. You know, I'm a healthcare worker, or I'm a first responder. They should first of all consider that you who is your employer, and do they have a vaccination plan? So check in with your employer to see if that's the case. If it's not, then if you're in a smaller facility of only like less than 100 people or 50 people in your organization, then we have these closed pods that Corey was talking about that we're having at Western and UNL, our Western and at Decatur, and appointments are full. But like I said, our partners are opening up some more appointments next week. And that information will get posted as soon as we have it.
Okay, we've got about a dozen questions now to get through. So we're gonna go to Will Stone from NPR. I am unmuting you now.
Hey there, thank you. Are you running into any challenges or unexpected logistical issues with the second shots? Like, how is that going? Are there any delays? And do you have any sense that people are not showing up for their second shot?
Well, frankly, we just got started the first week of December. And so those were the hospitals. So they're due for their second shot this week. And we got the vaccine out to them. And I haven't heard anything negative about getting their first, getting the second dose. It sounds like people are, from the feedback that we're getting, that they are looking for appointments, looking for ways to get that second shot. So right now we don't have that information. I hope that answers your question.
Yeah, Johan, I just basically the answer is that right now the second dose is limited to hospital employees because they are the only one who have reached that stage.
Okay, next up we have Jacqueline Schultz from Fox 5.
Hello, I wanted to ask if February or after January, if tier 1 will be complete, we go into tier 2. And how exactly, we're getting a lot of calls from seniors 75 and up wondering, how am I going to get the shot? How am I going to be notified? How large is this group? What are we seeing? And what would you say to all those people? We're getting a lot of questions, and people want some information on that.
Right, and there's probably going to be, now keep in mind, when we're done, we're never really going to be done with any tier. It's always going to be ongoing. So like the hospitals are always going to have vaccine for new people that come along. And so the tiers never really get finished, so to speak. But we move into the next tier as we offer vaccine for the first group, right? So 75 and up is a diverse group as any other group. Some are healthier than others. Some live in, congregate settings. Some do not. So it's going to have to be a multi approach to this, to meeting those needs. What we need to think about is how do they get their other vaccines and other types of healthcare. So it looks like at this point that pharmacies will be have some capacity to address those needs for that group. Healthcare providers, like I was saying, some of the larger healthcare providers will be getting vaccine in order to offer to their patients, and they'll be in that category as they're going to their physician. And then we have a couple of other partners that may look at the community and see where do these folks live, where are they in residential area, residential communities and assisted living. And so they will target those areas to provide vaccine to that group.
Our next question comes from Max Darrow.
Hey, I hope you can hear me. Max Darrow from Channel 3 here. Curious to know, as you move forward and continue to receive more doses of vaccine in the coming weeks and months, and ultimately do advance into the next tiers, what is the plan to both efficiently and effectively vaccinate people in Southern Nevada without any big hiccups like we're seeing in other states that are rolling out their vaccination programs?
Right. So it just like testing was a little, there were issues with that as well. We may find those issues. Excuse me. Sorry about that. But I think that using community partnerships and piggybacking onto current systems. So if you think about how did families get vaccine to begin with? How did they get flu vaccine? And a lot of that work was done by your healthcare provider and by pharmacies, and then of course our public health agencies. So we're still leveraging that in order to get the COVID vaccine out. And that's why we want healthcare providers to sign up with the state so that they are able to get that vaccine and give it to their patients and give it to the public. So it's like I said, it's a multi-directional approach. We're going to have large pods. The county is going to help support us. And we're looking at healthcare providers to get the vaccine, and then pharmacies. And really, it's all hands on deck for any healthcare provider that can vaccinate. Those will be leveraged to address those needs.
Next on the list is Miss Mary Hines.
Hi, good afternoon, everyone. Could you, repeat the number of vaccines that have been administered? And also, please provide a figure on how many vaccine doses have been delivered. And if you could speak to if there are any bottlenecks. CDC data indicates that for the state of Nevada, just under a quarter of vaccines delivered have been administered. And I'm wondering if something similar is going on in the county, if you can shed any light on that.
Yeah, sure. I will start, Joanne, and then you. We, as I mentioned before, we have administered 21,000 doses of vaccine until yesterday. Those have been administered by the health district, the hospitals, and the universities and other partners. The total doses of vaccines that we have received here in Clark County is 89,000. Joanne?
For the number in tier 1? It's around probably around more like 150,000, but the estimates were looked at lower based on intent to vaccinate.
The number of vaccine doses that we receive here in Clark County.
Oh, that's around 70,000.
Right. So that's the answer, and most of that vaccine was received during the last 2 weeks. So therefore, we are now in the initial phase of really going into a more active mass vaccination campaign beyond the hospital setting.
Right. I mean, we've really been concentrating on getting the hospitals up and going to get their vaccine to their workers. So and then Walgreens has started with long-term care in their residents. That started December 21st, which is 2 weeks ago. So this week, we started, really we're just at the beginning of our campaign and starting to vaccinate. So it looks like 20,000 is low. Keep in mind that that is a fluid number. As more people, you know, as of today, we probably have another 500 people vaccinated, and we're expecting to ramp that up fairly quickly. Our pods mostly, we're projecting about 1,000 per pod, and we have a lot of, we're planning to have like 4 or 5 pods at a time. So that number is going to increase quite a lot. Some of that vaccine that we received was second dose for the hospitals. So the hospitals have received that 12,675 that we received on the first December 14th. And then that's been distributed. And then another 12,674 have been distributed for second dose. So they're working on that. And so we have some vaccine on hand so that we can really start ramping up these next 2 weeks.
Next up is Megan Messerly.
Hi there. Thanks so much for doing this. I wanted to ask, so today the Washoe County Health District said that they're starting to vaccinate their K through 12 staff on Saturday. And I know a couple rural health districts have already started vaccinating K through 12 staff. I know this differs county by county, and you all are still working through that healthcare population and getting through the rest of tier 1. But is there any ETA of when K through 12 in Clark County will start being vaccinated?
Well, that group is in tier 2. So we're making plans already for Clark County School District, which is a lot of people, about 45,000 people. So we are making a big plan for those folks. So the tier 2 group is big, and we're looking at really doing some large scale pods for them. Now, as far as Washoe County being further along, of course they are, because they have less people. So that's why we're a little slower, and because frankly we just have more people to vaccinate. But I think we're not too far off, I don't think, as far as what the scope of our work has to be. I know there was some other questions about education. So in that tier 2 is, educators K-12, which we do, really want to focus on for our next group because we do want to get children back in school. NESHE, Nevada System of Higher Learning or Education, they will be in that group too. The professors, the teachers. UNLV right now is working on their medical staff, their clinics and that type of thing. And so those will be a high priority for us in the next tier for sure.
And it might also be with the Clark County School District and our charter schools, a more phased approach, because Clark County School District is one of the largest in the country. I think it's the 5th largest. Whereas Washoe County might be doing, K through 12. We'll have to work closely with Dr. Jara and our school district personnel and do a more phased approach. So we might do K through 3rd grade, but it really requires that close collaboration with Clark County School District administration to identify the subpopulations within their own agency that will get vaccinated.
We had a question in the chat box from Sally. She says, how many people won't take the vaccine? What are they doing if it's not used? And what about campaign efforts?
We don't want to hear anybody's not wanting to get the vaccine. Everybody should want this vaccine. And when their opportunity to get the vaccine is available, they should do it.
I will say that we're focusing right now on people who do want the vaccine. There's always a certain amount of people who jump on right away. Some want to wait and see how the vaccine's working out. And then there's some that will never get the vaccine due to whatever reason they may have. And I've talked about vaccine hesitancy before, and there's a lot of different reasons people may not want vaccine. So we try to address those issues one at a time. And I think that most of the healthcare workers are very excited to get the vaccine, and the uptake seems to be pretty well. And we're also starting to educate our population on how this works and what vaccines are available and the dosage, just some main things on our website. There is a V-Safe, it's called. It's an application that everybody has the opportunity after vaccination to sign up for and register. And what that does is it checks in with you from the CDC and monitors your symptoms. And that's how they're gathering more information about side effects and the effectiveness and the side effects of the vaccine. So they're gathering data as we're going along and just getting more information. So for those who need that information and are waiting, that will be available, sometime in the future.
Let's take a few more of our voice calls. Let's see, Julie Wooten Greener. Trying to unmute you. One moment.
Oh, I know.
Okay, Julie, it's not letting me unmute you for some reason. Let's go to Alexander Zapata from Univision. I'm asking to unmute you now. There we go.
Doctor Leguen, quisiera hacerle una pregunta en español, a ver si nos puede ayudar con la última actualización que tienen. Sé que dijo que habían 21,000 personas que habían sido dosis que habían sido administradas, pero también hay mucha preocupación en la comunidad de saber un aproximado de cuándo podríamos ver ese movimiento hacia otros grupos de vacunación, el 2, el 3 y así sucesivamente. ¿Qué nos podría decir al respecto a la actualización última que tiene y respecto a esta última pregunta de cuándo podríamos ver un movimiento? Gracias.
Okay. I will do that. Okay, I will switch to Spanish just to give a summary of the campaign. Zapata, lo que estaba diciendo era que hasta el momento, hasta el día de ayer, nosotros se han vacunado alrededor de 21,000 personas aquí en el condado de Clark. La mayoría de estas vacunas han sido ofrecidas a médicos, trabajadores de los hospitales locales y también a personal médico y de otras instituciones de salud aquí en el condado que no son parte del sistema hospitalario. Nosotros esta semana comenzamos a ofrecerle la vacuna al personal de salud y ¿cómo se llama? Los primeros auxilios que operan fuera del hospital. Empezamos con ellos esta semana. El Distrito de Salud abrió un puesto de vacunación en nuestra sede principal en Decatur y también un puesto de vacunación en la escuela, en la high school que está en Western High School. En este sitio se está ofreciendo la vacuna al personal sanitario de condado que no es parte del sistema hospitalario. En el condado se han recibido alrededor de 80,000 vacunas. La mayoría de estas vacunas han sido distribuidas para los hospitales para cubrir la primera dosis de los hospitales y ahora la segunda dosis que ellos comienzan esta semana a administrarse entre ellos. No sé qué otra cosa. ¿Tú quieres preguntar otra cosa? ¿Que me falte algo? Corey, can you allow Zapata to tell me if that's enough or he needed more?
Trying to unmute him again
Sí,
now. There we go.
doctor, nada más cuando podríamos ver un movimiento hacia los otros grupos.
Oh, ok. Bueno, nosotros estamos ahora mismo en el medio de la primera etapa y nosotros calculamos que en no menos de 3-4 semanas es que estaríamos realmente listos para empezar a trabajar en la siguiente fase o la segunda etapa de la campaña de vacunación. O sea que sería 3-4 semanas a partir del día de hoy aproximadamente. Porque recuerda que las personas tienen que recibir 2 dosis de vacuna. O sea que eso enlentece el proceso también. Okay, thank you, Corey.
We will be wrapping up very shortly. I am going to read the question from Julie Wooten-Greener because since I couldn't unmute her. She's asking, has the health district provided any guidance to Nevada system of higher education campuses to prepare for vaccine rollout? And also, does Tier 2 include just the NSHE faculty or also frontline NSHE staff? And do students living in on-campus housing fall under Tier 3?
You know, I just put a reply in, Corey, for in the chat, and just saying that UNLV School of Medicine, Nevada State College School of Nursing, UNLV Health Sciences, and CSN are partnering to provide vaccine for Nishi. For the first group, that will be healthcare workers, first responders, and law enforcement. Then Tier 2 would be the teachers, professors, and really Tier 2 is mainly meant to address infrastructure and essential workers. So I would say that support staff would be part of that.
And one more quick
and
question.
Then, yes.
Oh, sorry.
Yeah, and then students would be probably in that Tier 3.
3 and 4. Mm-hmm.
Mm-hmm.
And one more quick question that was in the chat. For the population that's not covered under a health plan, will the administration fee to the receiver be consistent across providers, like Walgreens, CVS, and other community clinics?
Yeah. Yeah, I mean, the short answer is yes. The administration fee is pretty much set by the government, so.
Right. Agencies can't charge for the vaccine, but they can charge for the administrative fee, and
yes.
that might vary between where which providers. I mean, if it's a pharmacy, even flu shots vary around the community on what they cost, but they're all relatively about this.
Well, I think perhaps that's a question that we have to take back and get a confirmation, because regarding the administration fee, what we can tell you is is that there is no any out-of-pocket expenses from individuals who come to our facilities or our points of vaccination, or also for the site that UNC or any of the universities are offering. But I'm not 100% certain about the pharmacies, how they deal with the pharmacy with the federal government is. So I would rather ask you to allow us to take back that question, and we can send you a feedback later. We check with the state.
We just wanted to thank everyone for joining us today and participating. If you're a member of the media and you have any further questions, please reach out to the Office of Communications. You know how to get in touch with us. Now, if you're a member of the general public and have further vaccine questions, send us an email at snhdpublicinformation@snhd.org, and we'll be happy to follow up with you. But remember, we do have our website, www.snhd.info/COVID, which is full of COVID information, vaccine information. As we get more information, more sign-up forms, more booking appointments or whatever, all that will be placed on the website. So definitely check that out from time to time. And please follow us on all social media. Thank you all for joining us today, and we hope you're doing well, and we'll see you next time. Thank you.